Okay, hi, can everyone hear me? Yep. Okay, thank you. So I just want to point out here, this is the New Jersey State Health Department COVID-19 dashboard. When you go to the website, which will be in the resources section at the end of this PowerPoint, you'll be able to go to this website if you are not familiar with it already. Just want to highlight that this is a picture of the state of New Jersey, and the circles show the impact of the specific areas. So you can see where Essex is by Elizabeth in New York. And the information on Essex County is that we have, unfortunately, the highest death toll of any county in New Jersey at 1,292 deaths. The current COVID-19 status overview from Maplewood as of yesterday is that we've had 263 positive cases. We've had 423 negative cases and 120 recovered cases. And I will talk more about that in a little bit. I also added this one additional section of probable cases. These are now cases that the State Health Department wants us to monitor, which are cases that have been in contact and are symptomatic after being in contact with a positive COVID confirmed case. So we will be monitoring those cases as well. So let me just go back.
Excuse me for a minute before we go into that. I just wanted to add, indeed, Essex County currently leads the state of all the counties in deaths at a reported this afternoon during the governor's conference, excuse me, of 1,319 deaths. And according to the press conference, in just the last 24 hours, we have seen 385 new hospitalizations. There are over 5,000 people still in hospital, half of whom are in ICU. So again, while the curve is flattening, we are still seeing that this virus is very much, very strong and spreading. And our total cases in New Jersey are at over 130,593. Which puts us really in the hot zone after New York State.
Absolutely. And Mr. Jaffes, thank you for that great outline of the presentation and those numbers. We had anticipated that they were going to change even as right before this presentation, so thank you for giving those updated numbers. These were just even from earlier today at 2 o'clock. So as we can see, the numbers are drastically changing, unfortunately, by the minute.
Right. So, Ms. Davenport, I'm going to lead you here a little bit out of order, if I may.
Yes.
Since we're talking about total cases, let's talk about the demographics of this data, if you will. Slides 13 through 17. We sort of get into a little bit what gender and age looks like, race. Do we follow state trends? And what kinds of, who do these cases represent? What are we seeing? What was that like a month ago? What is it like now? So starting on slide 13 and moving through slide 17, please.
Okay, sure. So let's start there. So again, we're back at the New Jersey State Health Department COVID-19 page. We're looking at their demographics. They have this really great way where you can break down the information. Start with the top left, which is the deaths by race and ethnicity. So this is information for the entire state of New Jersey. As your local health department, we enter in the data through the communicable disease reporting system. That information is collected, such as deaths, hospitalizations, types of illnesses, underlying health conditions, and that gets funneled up to the state, and they're able to aggregate it. So as you can see, this information, it has the ethnicities that are affected, with the number of cases and the number of deaths. At the bottom, it shows deaths by age group. You can see that the deaths don't really have an impact until you start to go to the middle age, starting at ages 30 to 49. And then it increases rapidly and exponentially as you get older. So age or advanced age is one of the major health risk factors for COVID-19 and death, unfortunately. The other major risk factor is underlying health conditions. So other underlying health conditions refers to cardiovascular disease, which, as you can see, at 58.8% make up a majority of the cases. Moving on to diabetes, unfortunately, puts you also at risk. And then other chronic diseases include mental, vision, speech, hearing, and other immunocompromised or autoimmune diseases. And then you have other issues like chronic lung disease, neurologic developmental disability, and renal disease. Moving on to the next slide. This is the Maplewood Health Department, Maplewood Public Health Division information. So we have 21 deaths in Maplewood, and those deaths are broken down by female and male. So you have 10 of our patients were female and 11 of our patients were male. And also on the number of COVID deaths, you'll see that the breakdown of the percentages of those cases. So it's evenly spread out pretty much, but our cases don't start until your mid-40s. And those who have died have also been up into the ages of over 100. The progression of cases across the state in Maplewood, is comparable to how the state has seen their cases progress. So when we were first starting to do our investigations at the beginning of February or in the middle of February, we were really only looking at international travel. So those traveling from China, Italy, South Korea, and Iran when COVID-19 was being spread and news was going on over there. However, as we have pulled back on international travel to those locations, we were still internationally traveling throughout the country, and unfortunately it had spread rapidly throughout other countries where we were visiting. So we pulled back and put in federal restrictions on business and leisure international travel, and we saw a decline in those types of cases. But then we start to see cases of domestic travelers, both business and leisure. And once we put down, we prohibited that, we saw a decline in those cases. However, then we start to see attendees of large gatherings or conferences. We'd see cases of that. So pulling people back to gatherings of 100 to 50, we saw a huge decline in the number of cases from that. And then we start to see cases working in New York City and those who use public transportation. And I think because of where we were and because of the impact that was happening greatly in New York City, we had then bringing us to March 21st when the governor's stay-at-home mandate was issued at March 21st. I want to highlight our colleagues at the healthcare system. COVID-19 has really shown us that not only is public health and healthcare always been a connected entity, but healthcare was dependent, and it's so dependent still on our ability to stay home. We watched our healthcare system literally buckle and crumble in certain areas, and the fissures in the healthcare system was unbearable at some point. We were not prepared for any, we didn't have enough PPE. We weren't sure if we had enough ventilators or equipment. And the cases just kept coming and hammering, and it was really very scary. So the stay-at-home mandate, and when we go over the data, you'll begin to see that the social distancing makes the difference. And the reason why we're staying home is because of them, and to give them time to recuperate, revamp, prepare, so that we don't have to make hard choices like who will be given care or not, or will there be a bed for me? And hopefully we'll be able to have visitors again in the hospitals if COVID can be under control. So I just want to bring that to everyone's mindset, that they are the reason why we're staying home, because if they aren't ready, or if we don't have a healthcare system, we won't make it. We just won't. So unfortunately now, because we are all staying home for the most part, the ones who are getting sick are the ones who can't. So those are your healthcare providers, our first responders, and our essential workers, those people who have to go to work in order for our country to still continue and our society to continue. We're also seeing cases in the elderly, in long-term care facilities and nursing homes. This was devastating, as you can imagine, with COVID-19. As I said, advanced age is a major risk factor. And so we saw throughout the state a lot of deaths in our nursing home facilities, which impact the numbers in towns that have long-term care facilities, one or more. So bringing us back to the state health department data, you'll see that 508 facilities in New Jersey have had outbreaks. And again, you can see the impact by the circles, and you can see where it's impacted. The Northeast is greatly impacted, but it starts to move down further, both south and west. And the number of cases at long-term care facilities keeps growing, and that's unfortunate. And again, the most impacted are the residents of those facilities as well as the staff. And then I want to add to that the families of all of the healthcare workers, essential workers, and everyone who is still working. And I believe that takes us to our essential workers. Would you like me to continue from here, or would you like me to?
I think I want to stop here for a minute and just kind of zoom back macro and just talk about how, would you say then, in your experience, that our demographics reflect state aggregate data in terms of race, gender, socioeconomic class, et cetera?
Yes, absolutely. We are a small microcosm of the impact at the state level. But every township, every region will be different, right? So when we listen to state phone calls, those who have migrant farm workers have an issue that we don't have here. Those who have correctional facilities have a different impact. Those who have more than one long-term care facility, which we have one long-term care facility and one senior apartment building and 9 group homes and 1 dialysis center. Those things that make us unique and are our strength. But for many places that have 3 more or 11 nursing homes or long-term care facilities, they are seeing a bigger brunt.
Right. How would you say that we compare to municipalities who are similar in population size, density, and socioeconomic demographics and diversity?
Right. So I just want to reiterate on one of my slides, based on the U.S. Census data, we are approximately at 25,000 residents. We kind of fall in Essex County right in the middle. And there's not many people who are about our size. But what makes us different is, I mentioned the vulnerable population. We are a population of 25,000. We have a working class population who are the workers in healthcare and essential personnel that I mentioned. They are also our strength because they add to the diversity of Maplewood and why Maplewood is really special. I also want to mention that we have multifamily housing units. So we have many families who live in Maplewood, some who live in multi-housing dwellings. COVID-19 tells a story about density. It's about close proximity, and that's how it can spread, unfortunately. We also have, unfortunately, an uninsured population, so access to care can be an issue. Based, again, on the U.S. Census data, 6.7% of our residents in Maplewood under 65 years do not have health insurance. And 24% of our residents are ALICE qualified, according to United Way, which is access limited, income constrained, but employed. And with this economic crisis, that number's probably increased significantly, if not moved over to the unemployment side. And as Township Committee Member DeLuca had mentioned, 25% of our population are renters. I'd also like to mention that 18% of our population is foreign-born. So all of those make up how our demographics are impacted by COVID-19.
Right, that's fascinating. Thank you for that breakdown. Let's move on to how we got here. Slides 9 through 12. Some really great graphs there that really show us, well, they show how long social distancing took to take effect, right? And they talk about, they really tell the story of the waiting period of this virus based on its incubation. Can you go into that a little bit and walk us through?
Sure. So this is the number of daily new cases in Maplewood. As you can see, some of the days were easier to deal with than others, but you'll begin to see the cumulative on the next couple of slides. So we started our first case on March 14th. This was our first confirmed case that was not related to international travel to China or Italy. And then the cases started to go up exponentially over time. You begin to see like around after April 4th, there's a peak and then another higher peak still around April 17th. This actually mimics to the T what the state health department said that the entire state went through, which is the New Jersey state peak was April 6th with another peak around April 17th. And when we ran this data, Anna and I were like, oh my gosh, this is exactly the same numbers that we were seeing. I want to point out that March 21st was when we had the social distancing mandate. And unfortunately, it takes almost a month for any change in society to make a difference in the rates of cases and the hospitalizations and deaths. So I just want to reiterate, it takes almost a month for us to see change. So as we lift any new restriction, unfortunately at the Public Health Division, we anticipate that in a month, we will begin to see cases if people do not continue to follow social distancing practices. However, I also want to reiterate that it is the decrease in the number of cases. That's what is showing what social distancing has done. Without social distancing on March 21st, these numbers would have gone higher. There would be a more prolonged, unfortunately, a prolonged event of cases. The peak would have been later. And this decline, this important decline after April 17th would not have been possible had it not been if we didn't social distance. As I mentioned, there was this gradual decline of cases by certain types with these restrictions, travel restrictions, stay-at-home measures. All of those made a difference to the number of cases. And again, I want to reiterate, if we had not social distanced on March 21st, the number of cases that you see here would have been more every day. The peak would have been later, and we would have had a prolonged number of cases, and you would not see this decline as we see now.
One of the variables here that we should mention also that's playing into this is lack of widely available testing, a lag in receiving test results, and the challenges of contact tracing, right? Limited contact tracing at this point. Can you speak to that as well?
Well, there wasn't really limited contact tracing because that's exactly what we were doing every time we saw any of these cases. However, I will say, yes, that is absolutely correct in terms of the limit in testing. So the testing lag that we talk about in the news media is true and correct. You'll begin to see at the beginning, there weren't as many cases, but as always with more testing, you will get more cases. And most of the cases, about 86% of your cases will be mild to no symptoms, but will test positive. And then you have these confirmed cases, and these are what we're seeing. Actually, they're saying that in certain studies, if you have 14% of your confirmed cases, just multiply that by 7, and that is your actual number of cases in that community. So that's kind of significant. Again, these are just a snapshot in time of your confirmed cases and those who received testing. There's many who have not tested. I'm just going to move on to the total number of deaths. Again, we had 21 unfortunate deaths in our community. And so our first death was around March 29th, which was significant. And then it went up further. Our highest peak of deaths matched the same peak that we had a total number of cases. I want to point out a very positive message here, which is that our last case was on April 23rd. And that's a really significant thing because, again, this is what social distancing can do. Without social distancing, there would be not only more cases, there would be more hospitalizations and more deaths. To provide some context, Maplewood's 21 cases make up only 1.6% of the total number of cases in Essex County, and that was when it was 1,292, so it's roughly about that same number. So again, here's the picture where you can see the total number of daily cases and the total number of deaths side by side together. And here's the total cumulative. So when you see we have, 2 cases on one day, 6 cases on another day, 3 cases on the following day, those are not just 2, 6, and 3 cases. Those are cases that have increased over time, and we have to follow it. So at some point, we have overseen 263 cases. What I'd like to say here is that we have 120 recovered cases, but I'd like you to note that if our first case was found on March 14th, it took almost 2 weeks to have a recovered case. So that's significant. And then the recovered cases are following the trend of the number of cases, and our current cases that we're looking at are between the blue and the orange. Okay, so that's our differential that we're currently active and working on and following. What we'd love to see, like you had said, like there's the plateau, but then there's also the coming down. And what we'd love to see if we continue this graph is the orange or the recovered numbers will go up, and those positive active cases would go down, and they cross somewhere in the middle. That would be the ideal for public health. And we're back to slide 14.
Right, terrific. So can we go a little bit into how the virus works, its incubation period? You sort of mentioned it a little bit there when you were talking about, the 2-week waiting period in between the first case and the first recovery.
Right. So I'm going to go back to the, some previous slides, which is what COVID-19 is. COVID-19 is an illness caused by a virus that can spread easily from person to person. This virus in particular is a new coronavirus, which means it's a novel virus that we have not been exposed to before and has spread globally, which gives it the status of pandemic. Unfortunately, with the symptoms, they can range from mild or no symptoms to severe illness, hospitalization, and death. So the reason why social distancing is important is because 6 feet is the distance of when someone's cough, sneeze, or even when they're talking, their sputum that comes from their respiratory droplets can contact somebody if you stay less than 6 feet. So the 6 feet distance or 2 arm lengths are super important to prevent the spread of disease, because this disease can primarily spread from person to person. That is the main source of transmission. Infection may be transmitted by touching a surface, but that's not the main reason. It's person-to-person contact, or touching an object that has the virus on it, and then touching your mouth, nose, and eyes. And as I mentioned, anyone can spread it, unfortunately, if they're infected. They may not show symptoms, and everyone is vulnerable. And let me just go back here. So the incubation period of COVID-19 is 2 to 14 days. That means it's the time between the moment of exposure to someone who was sick, and then the time to when the first signs and symptoms appear for that other person. The incubation period, a person may be able to spread COVID-19 even if they do not show symptoms, and up to 2 days before they begin to show symptoms. So that's why COVID-19 can spread so easily, because even 2 days before we're symptomatic, there's a potential that we're already shedding it. So wearing that face mask and keeping those respiratory droplets away from other people is key and very crucial. The symptoms of COVID-19, everyone has heard about the cough, fever, and shortness of breath. Unfortunately, as we've learned more and more of this virus and we're following up with cases, the symptomology has increased to chest tightness, a very bad headache, body aches, chills. A loss of taste and smell was something that has come up over time as we've been following this. A loss of appetite, sore throat, diarrhea, nausea, and vomiting. While we say that the symptoms are similar to a common cold, influenza, and seasonal allergies, unfortunately, there are other more severe symptoms like pneumonia, acute respiratory distress syndrome, and a new one that we're finding out is blood clots. This disease keeps morphing and changing, is very dynamic. So unfortunately, the blood clots can lead to other issues, side sequelae, like deep vein thrombosis in your lower extremities, a heart attack because the clot is traveling through the body, a pulmonary embolism where the clot lodges in your lungs and you can't breathe, and embolisms that travel up into the brain and can cause stroke. So these are really significant issues, and we're watching this closely. Here's some unique characteristics of COVID-19 that I want everyone to understand, as we have been doing this for about 7 weeks now. So high susceptibility. This is a novel virus, one to which we have no immunity. While it is related to the same coronaviruses that cause the common cold, it is also related in the same spectrum as SARS. In fact, coronavirus, or COVID-19, is called SARS-CoV-2 because it has a relationship to the novel and more deadly viruses of SARS and MERS. So coronavirus, or COVID-19, has a spectrum. And we didn't know when we first started what that spectrum, where it lied in that spectrum, but we have more of a clear idea now. The scale of COVID-19 is a global pandemic. This is a global pandemic that we have never seen in our lifetime. It is a one-in-a-century experience. So to that extent, we weren't prepared because we didn't understand what we were dealing with. We did in 2009 have experience with the H1N1 swine flu pandemic, but that was nowhere near the scale of what we're looking at right now. And while it is comparable to the flu, they're not the same. In fact, influenza is one virus type, coronavirus is another. Aside from the fact that they are viruses and that they share the same symptoms, and both can lead to hospitalization and death, the degree to which SARS can cause, COVID-19 can cause it, and flu are totally different. I'd like to say that as flu is our only frame of reference in the United States, when we look at Asia and what they knew was coming, they had experience with SARS in 2003. And so they realized that these are both coronaviruses and they had to be prepared because they weren't sure what this was going to be like. So it's significant that we must not underestimate this virus and continue to compare it to a milder case of flu. It is definitely not that. High transmissibility. This is about speed. So according to an article in Nature, while SARS had a higher fatality rate, which means it killed more people that it infected, COVID-19 does not kill as many people, but it spreads much more. It's more pervasive in the community. So on that note, let me give you an example. It took less than 2 months from the first COVID-19 infection for the number of confirmed cases to surpass the total number of confirmed cases of SARS over several months. So it's about speed with COVID-19. COVID-19 also spreads more easily than seasonal flu. So again, the comparison is not the same. It's important to note that the replication rate of COVID-19 is about 2 to 3 people. So for every 1 positive case, and you have to anticipate that there's going to be 2 or 3 more. And that's why contact tracing is going to be so important as we move forward. Once it gets a foothold in the community, COVID-19 unfortunately does not leave. There is no certainty that it will leave in the spring or summer or even with warmer weather. Mr. Osterholm, the director of the Center for Infectious Disease and Research and Policy at the University of Minnesota, said that COVID-19 will not stop until it infects 60 to 70% of the people in any community. Moving to my 4th bullet, which is high rates of hospitalization and death. Because COVID-19 can spread even among people who are seemingly healthy because they're carriers of the disease, and because it spreads so easily from person to person just from respiratory droplets. Imagine being in a large gathering or a stuffed subway car. It is therefore able to cause more illness and hospitalization and death of people. So again, I said everyone is susceptible to COVID-19. Again, I'll reiterate that there are 2 major factors though, that even healthy people can get sick from it, but advanced age and underlying health conditions. And finally, the more important thing is we do not have a vaccine. This will come up in Governor Murphy and the national road to recovery is getting that vaccine in order to create that herd immunity, which vaccines are good for. So unlike seasonal flu and other viruses that we have vaccines for, like measles, mumps, rubella, and varicella, we do not have a vaccine for this or a formally approved standard of treatment. So I want to reiterate why some people ask, why is social distancing important? As we relieve the restrictions little by little, I want to reiterate why social distancing is important. Without a vaccine, social protective measures are the only effective way to control the spread of COVID-19. Please remember that COVID-19 easily spreads from person to person. So therefore, the more contacts you have, the more the contagion risk goes up. So I'll reiterate that again, the more contacts you have, the more risk the contagion goes up. So by social distancing, you are limiting your number of contacts, which is exactly what we need to do. Social distancing, is more than just standing 6 feet apart. It is about limiting the number of contacts you have. So avoiding large groups of people, avoiding non-essential travel, avoiding mass and public transportation, and limiting exposure to places with high-touch surfaces and going out for essential needs only are crucial in understanding. And that's why the stay-at-home mandate was so important and so crucial to seeing us see that plateauing and decline in the number of cases. Mr. Gaffis, you had mentioned about COVID testing versus antibody testing. So I just wanted to give a brief comparison. They're not the same. So COVID-19 testing is a test that you take if you've been exposed and are infected. Initially, we were only testing people who are symptomatic, but that is no longer the case. In fact, we should probably be testing people who are asymptomatic or show no symptoms as well, given that you can spread the virus even 2 days before you begin to show symptoms. So the test is a nasopharyngeal swab, the long swab that goes into your nose, and it takes a sample and then it's tested. There is a saliva test that is forthcoming, and that will make testing much quicker. In fact, they're looking at anywhere between 48 hours to even a rapid test of between 3 to 15 minutes. So that will be a major game changer in identifying positive cases and then getting their contacts really quickly. The nasopharyngeal swab takes about 2 to 4 days. So there is a lag time from the time you get tested and showing symptoms, and maybe by the time you get your results, and then by the time we get you and contact the patient, they might already have been recovered. So the saliva test is going to be important. The antibodies. Yes, Ms. Adams.
Yeah, do you have any timeline on the saliva test when it's coming? And it's also much safer for the medical workers because they don't have to have contact with them, right?
That's right. They would just spit into a little tube, and they could run the test from there. So the state has, from Rutgers, they have rapid tests now in a couple of facilities. They have it in Hackensack, and I believe somewhere it's either Robert Wood Johnson and other larger hospital facilities. And they are also using them in state facilities like developmental for special needs people who are in congregate locations. Again, because of density, you want to make sure that the staff and the patients are well in those areas. So they're looking at the most vulnerable. If the tests are working and they're able to generate a good positive case and it's specific and sensitive enough, then they will start rolling that out very quickly. And we're really looking forward to that. And then let me just move on to the antibody or serology test. This is a test that tests if you have developed immunity to COVID-19. So now that you have antibodies, it is a blood sample, and they test your serum, your blood serum for antibodies. You take this after you've recovered, so no more symptoms of COVID-19. And this test allows you to donate plasma to test for antibodies. If you would like to donate plasma and you have recovered from COVID-19, on the township website, we have information on where you can look for plasma donation. And we would really appreciate that because that allows us to look at how many antibodies does a recovered person produce? And maybe we can synthesize those and use that as a part of treatment. As I mentioned, these tests are just a snapshot in time. So just because you're negative on Tuesday does not mean you can go to a party on Wednesday, because things can happen and you can become infected. So again, it's just a snapshot in time.
Thank you, Ms. Davenport. What are the chances, how soon do you think we could see more testing sites available, including walk-up locations at your local CVS or Walgreens in our town?
Right. So you had mentioned the Essex County EssexCovid.org website, which is the drive-through
Yep.
for Essex County, and it's free. But it's limited because it's only Monday, Wednesday, Friday from 9 to 12, and we're not sure how long that's going to last. We are hoping that, but it would all depend on those larger facilities like CVS and Walgreens, those larger corporate national entities, to begin to roll that out and do a saliva test. So we are watching that closely. Luckily, we have a CVS in our backyard, and Walgreens as well. So once they start to roll that out, it can be as easy as a drive-through, and you just put it in, and then hopefully it'll say, one day we'll get to that place where it'll say, you're positive, please go home and don't go to work and isolate yourself or quarantine yourself. Or it'll say, you're negative, continue on, have a great day. So that would be the ideal.
Terrific. So with everything that we know now, let's move toward the end of our presentation. The path to reopening. What does that look like?
You got it.
And that's slides 18 through 21.
You got it. So as you mentioned, Mr. Davis, I want to reiterate that this is the governor's message from his office, that public health creates economic health, and it just comes down to the basics. If you don't have healthy people, people won't be there to work. If you don't have healthy people, no one will go to a concert. No one will go shop at your store. If we can keep the cases down, and if we keep our hospitals viable, public health creates economic health. So I want to bring us forward to Governor Murphy released a roadmap to recovery. And these are the 6 key principles that Governor Phil Murphy announced in his vision, which is the road back, restoring economic health through public health. So again, his office definitely sees the connection between public health and bringing back the economy. So I want to reiterate that there are 6 principles here. One is sustained reductions in new cases. As you saw in the number of daily cases, we were mimicking the state. We have seen a decline in the number of cases as well as the number of hospitalizations. So that's key for them to start looking, which is what they have been, at the 14-day decline of cases and hospitalizations. Principle 2 is expanded testing. As we talked about with and not only antibody testing, but the saliva test and COVID testing, the faster we can get expanded testing, which is the rapid testing, the faster we can get that to people, the more it can be accessible and the more available it is to all communities, the healthier and better we'll be, and we'll be able to have more confidence of going out to the community. Moving on to the 3rd principle, which is the implement robust contact tracing. We would need to, once we get the rapid testing, if, for example, someone is positive, we would then get that test result at the health division, and then we would be able to contact that patient and say, please tell us who you're in contact with in the last day or 2 before your symptoms started. And hopefully, ideally, as we increase these restrictions and as people are going out into the community, that everyone will still be doing some social distancing so that you'll be able to remember where you went and who you had contact with, because that'll be important for contact tracing. We need to be able to reach as many people that you had contact with so that we can contact them and tell them to quarantine themselves. And by doing that, hopefully we will stop the spread of disease. The disease spreads when people don't know that they have it and are not practicing precautions like social distancing and wearing face masks. So robust contact tracing will be key. But of course, these are stacked. One can't happen without the other. Securing a safe place for isolation, this is really for people like our first responders, like those who don't have housing, like those who have people who live in their homes that they don't want to infect. How will we ensure safe places for isolation and healing and recovery? Number 5 is executing a responsible economic restart. And again, that's really looking at what we were talking about with Congressman Payne about providing resources to local businesses, small businesses. How do we replenish downtown Maplewood and bring it back? How do we replenish Springfield Avenue? And open that over time. And then ensure New Jersey's resiliency, which is to look at what can we do better? How do we prevent this? And what can we do moving forward? And of course, making sure that our hospitals and healthcare systems have what they need and are viable to sustain not only COVID cases, but all kinds of other cases like trauma and injuries and things like that. So moving on to what safeguards do we need? This is really all about when can we come back together? So reiterating what the governor's road back policy was, is increase in rapid, accessible and available rapid COVID testing, a robust system of skilled contact tracers. But I do want to mention that the public's compliance with isolation and quarantine measures is key to the success of this. If people aren't going to abide by quarantine and isolation practices, it's not going to work. So again, the dependence and interdependence of society is really dependent on individual actions and behaviors. Increased healthcare capacity and our standard form of treatment for COVID-19. We're already looking at what can help. Antibodies might be able to help. Antiviral drugs are looking like they can help. Certain classes of medications like biologics are looking to be very promising in reducing the number of cases and hospitalization days that one has and the severity of cases. So that's important and crucial. But if we had a standard, that would be excellent. And then, of course, developing a vaccine and mass vaccination. So moving forward, here are my recommendations. And these are not just my recommendations, these are public health guidances and recommendations. Why does social distancing need to continue? We need to continue social distancing to reduce the number of cases infected. It also, again, buys the healthcare system time to be prepared. And we can't resume a vision of what we had before until we have a vaccine. So always anticipate for the next coming months that some form of social distancing will need to continue. Again, as you reopen things, you don't have to go whole hog, and you really shouldn't. You have to control how many contacts you've had. This is going to be key for contact tracing. So expect that there's going to be stops and starts with our restriction lifting. We might have to pull back on certain things. I advise you to prepare an alternate plan for not only canceling or postponing gatherings and events, but canceling them. There should be a plan B and an alternative on how do we deal with things that may not happen that we expect would happen in Maplewood during the spring, summer, and into fall. Just anticipate that some gatherings may not happen. In fact, gatherings of more than 10 or even 5 are still illy advised. We don't advise those at all, just because the more context you have, the more risk you have. Anticipate a surge of cases with each loosening of restrictions. So in public health, what we do is we monitor the cases, we monitor the data, and we deal with the patients. Anticipate another surge of cases. Every increase in social mobility and opportunity for gatherings, we will see another case. There is no second wave in the fall. I think nationally why they say that is because most companies and states are looking at opening more things like school and their businesses, again, these large gatherings in the fall. So I think what they're saying nationally is to prepare for a bigger wave, but the wave is coming as soon as you open up restrictions. I want to also reiterate that the messaging is not business as usual. Again, reiterating that there will be some form of social distancing, gradual openings of various sectors and businesses. People still need to wash their hands after coming in from any public space and wear a face mask to protect those respiratory droplets from getting out, wearing it in any public space. And please avoid visiting elderly or having them visit you and visiting those with underlying health conditions. Unfortunately, they are still very much at risk. And these are our resources for assisting people.
Thank you, Ms. Davenport. This is very comprehensive. As you said, this is a very fluid situation. We want people to stay engaged. The mayor does a great job as do you in informing our community daily of what's happening here locally about resources like this that they can access. I know that you work very closely with county officials and state public health officials, and you will share guidance that you receive about all of this, about public gatherings and public events, summer events. And we will certainly follow what the doctor orders, right? Science equals confidence. Without confidence, it's just not worth risking, another pike in uptick rather in infections and God forbid deaths. So
yes,
yeah.
Whatever the governor, and I want to reiterate on these resources, there's the second bullet that people may not be aware of, but I know you and I and everyone on the township committee is aware of because we watch them regularly, and all the administrators, is Governor Murphy's daily press conferences, which are on YouTube. Sometimes the times change, but they're usually anywhere between 12 and 1. And so people can follow Governor Murphy's press conferences on his YouTube. Just look for New Jersey Governor Murphy on that YouTube, and you can see where his announcements are. Any announcements that he has that impact us locally, public health is there to support whatever we can do to help open things up, but also do it cautiously and to preserve that social distancing that we need in order to reduce the surge or like large spike in cases.
Wonderful. And I see you also include there the state dashboard for those folks out there who want to dive even deeper into the data. Everything that you could possibly want to look at is going to be there. It's very available. So with that, Mayor, I open it up to questions. Do we have any questions?
No questions from me, but I just wanted to thank Candace for your hard work during all this and for all that information, very comprehensive and also just very plainly and, spoken so that everybody can understand it. And it's really, really great to have you in charge of this. So thank you.
Thank you so much.
Any other colleagues have questions?
Yeah, I just want to say I'm actually going for my test at Essex County tomorrow morning. I jumped on it as soon as they made it available. I think that those of us in public life, we should model our behavior. And I think more people need to be tested. And this is going to be the way of life going forward for a while. So thank you, Candace. I agree with Ms. Adams. You've been terrific in this. I did have one question. I know for normal people, you want to keep a distance of 6 feet. You want to stay further away from politicians because of all the things that we emit?
Yes, stay away. No, I do think that you guys are at increased risk. Unfortunately, what you have done with social distancing and modeling that with our town hall committee meetings and all of the meetings that we have in town hall and able to still keep the government functioning is key. But as you move forward, I think the expectation has to be that you can't meet with large groups of people, at least for a while. It's just not the best practice. So people have to understand that there's maybe no handshaking, maybe no large gatherings, no large groupings, but you can still be very active and viable in getting your messages out through these social mediums.
And I just want to add that we have heard from the county today, which highly recommends that people use face coverings when they go outside, period. Not just when you go to areas where you might run into a greater amount of people, like a public park setting, for instance, but just generally when you go out, it's probably a good safeguard. It protects you, it protects others, protects all of us. So we should definitely get that messaging out to people and remind them to do that. So with that, invitation for the public to address the board. Do we have any public questions?
Deputy Mayor, we have a few public comments if now is the time.
Great, terrific, bring them on.
Okay, the first is from a Miss Joan Crystal at 4 Quarter Avenue. The question is, what testing accommodations are available for those who have no access to a car?
Okay. If you have no access to a vehicle, Joan, let me get back to you on that information. I know we have drive-through testing. You can also, if you have someone who can drive you to an urgent care center, they will also be able to see you. You don't have to go through drive-through, you just walk in. Just know for everyone, when you go to those urgent care centers, just like in hospitals, only you can go in so that you reduce the exposure of anyone else. So no other, just like in the hospital, no visitors. When you go to urgent care to get urgent care center to get tested, only you can walk in. So that's important.
Okay, thank you.
On that, Joe.
The next question is from a Miss Mary Barman of 41 Plymouth Avenue, and she came a little late to the presentation, so she apologizes. She wanted to know, is there a breakdown by race? And if so, do you also have a neighborhood breakdown of cases?
Okay, so so as I had mentioned, the state holds all of our aggregated data throughout the entire state. It's really the best comparable data for race and ethnicity that you can see, because you can see the full picture in breadth. So you can go to the New Jersey State Health Department COVID-19 dashboard, and you'll be able to see the number of cases by race and ethnicity there. As for locally, we have not done it by neighborhood, only because our focus right now is really on getting people identified, finding their immediate contacts, and then providing them with education and the resources that they need to move on and recover. So that's really our major focus right now. But again, all of that racial and demographic data can be seen at the state level.
Does the state report list for local or just aggregate for the state on race and ethnicity?
I believe that page is just the entire state. I believe that as we keep moving forward and we get time to process the data, more we'll be able to break down by county. But as of now, that's the information. And we take our time when we do the case investigations to ask all of that information, and then that gets loaded up to the state.
Okay, Ms. Davenport, there was a follow-up question by the same person, Ms. Mary Barman, that says, what is the Maplewood breakdown, not the state?
I think we just answered that question, but go ahead, Ms. Davenport. Do you want to underscore that?
Right. So maybe she missed the presentation part of, and I believe that it's going to be released to to media tomorrow, but we went over the age range, and we went, which is comparable to the state. We went over the gender, which was also comparable to the state and equal in Maplewood. And trying to think of any other demographic data that we did. We also went over a number of cases and the cumulative number of cases. So that's really what our focus